All right then. Welcome everybody, and I guess I am chained to the desk here so that the microphone works for the folks who are on GoToMeeting. Welcome all of you as well. Do feel free, as Marilee said, she's monitoring any sort of chat questions and other things as we go forward, so do feel free to ask questions as we go. I am really looking forward to being able to sort of talk about the idea of getting media coverage, because it's not necessarily easy. And even though we've actually been really successful in our Stigma and Resilience Among Vulnerable Youth Center in getting media over the years, partly that I think is because the kind of research we do lends itself to a certain amount of public media. It's like, who doesn't want to know about teen sex? It's that sort of, oh my God, what are they doing now? We need to be, paying attention to this. So to some extent, some of the research that we've done has lent itself to media pretty readily. But we haven't always, frequently, even when we're like, okay, we're in the zone, we're going to do this again, and we pitch to public affairs, and they will say, nah, we don't think that that's really worth it as a story, or, well, you guys have already had these kinds of stories out in the past year or two. Maybe we should wait on another one and not do this one. And so if you want to do something else yourself, fine, but we're not going to pitch it. And it's been sometimes random, it seems like, when or why they say yes or no. So we've had a chance to sort of do some more thinking about this idea of the ways of getting coverage out there for research, including that question of, should it even be getting media coverage, or is there different ways and more effective methods of actually mobilizing the knowledge for the people who need it? So our lunchbox today is going to be focusing on considering some of the steps, including audiences, identifying the story in the research or the study that you've done, and some tips for framing your pitch to both public affairs internally at UBC as well as to people outside. And if we have enough time at the end, an opportunity to actually maybe do a little bit of workshopping around someone's specific research topic, something that you are thinking, maybe this could be something that could get media coverage. How might we look at that? What might that do? So first, let's think about should you even go for media? Hi, welcome, come on in. Not every study actually benefits from media coverage. And in fact, sometimes about the last thing you want is actually to get out in major news, as opposed to really focusing on the audience or the policymakers or the people that you want to sort of take action. So that said, most research has the potential to really benefit in terms of raising that visibility in media. So I like to think about asking, as I'm thinking about that research, asking myself some key questions about whether we should go to the process of pitching something for media, because it's a certain amount of work, and especially since you have to block off part of your time to actually do those interviews with people. So first, who needs to know about your research findings? If what you're proposing is research practice that affects a very specialized group of administrators or nurse clinicians in a particular field, and you already have some great engagement and community connections with those settings, then chances are going for a news article in, the Globe and Mail is probably not going to be as effective as working your professional associations, presenting at in-services and conferences and things like that. On the other hand, if part of what your research is about is actually what I call the changing hearts and minds about a phenomenon, so helping people think about an issue differently, or raising awareness about an issue in healthcare that is not widely known, but that the public needs to know about because it will affect a number of them, or it might affect allocation of resources, or getting that sort of the community mobilized around an issue, then media is a really important strategy for making some of that more visible. If there's policy implications, and again, it sort of depends on which kind of policy, because if it's policy like there's a law that's being proposed and it has a huge impact on the particular healthcare setting or research that you're doing, and your research can be brought to bear to influence that policy or to inform that policy, then maybe the media is a good place. But the pros and cons of that are, how complicated is the policy? Because if it's something that is a really complex system issue that takes a while to explain, then maybe media is not your best choice, and directly engaging with the policymakers and the key advocates for policy might be a better choice. And then another one that I think is one of the ways that UBC is frequently covering research that is in like the sciences. I think about, they cover a story about the latest cool thing that somebody's doing with worms, and you're thinking, yeah, that's not something that the general public is going to affect their daily life. But it does end up being one of those, cool, geeky, news of the weird kind of stuff, but also it has a way of reflecting back at the university as a, look, we're doing some groundbreaking research in this specific little field on worms, who knew? But it's a way of sort of reflecting well that we are engaged in the scholarly enterprise. So if your research doesn't sort of tick the boxes of, this is something that everybody should know about, general widespread public interest, or maybe this isn't something that has, huge impact on broad systems of nursing care, maybe it's not about changing hearts and minds or influencing policy, there still may be a story there about, this is really cool research that we're doing at UBC, leading the way in this particular area, and it makes the School of Nursing look good, especially if a piece of that story might be, and here's how we're bringing students involved in that research. So it may not be so much about the research findings as the research process. And so that, for me, the answer is usually, we can come up with one way or another that the answer should be, yes, you should have media coverage. So some examples, just to sort of start the process of thinking about, should you get coverage or not. One of our papers was actually a study that had two different papers that were published in 2014 and 15 around gay-straight alliances and LGBTQ inclusive policies in schools, and their link to suicidal ideation and attempts and problem substance use among adolescents. We got widespread media coverage for those particular stories. Another peer-reviewed paper in an even higher ranked child abuse and neglect journal on methods of that came about in terms of our systematic review of research about sexually exploited boys. There's a sensational topic, but the paper was about how trying to do the systematic review was really complicated and difficult because of the way people are doing the research and reporting the research. That paper we didn't even pitch to public affairs because it really doesn't, it's a methodology and a scholarly, this is important for researchers, but the general public is going to go, why is that important? What? So no story related to that. So it is sort of thinking about how these things play out, paying attention to what else is out in the general media, what's going on in like the wider public around politics or controversies or things that are influencing people's awareness. So I think, for example, of Allison's work, there is a lot of concern and awareness and news stories about the elderly and about the aging population in society. And frequently you'll find the occasional stories about people living with dementia or other kinds of things. And so chances are just about everything you do, unless it's, hey, we've come up with a new way to measure some phenomenon with a new psychometric tool, chances are a lot of the research will have some really great potential media possibilities. But other aspects of work that we do, I will never forget my one of my first mentors in nursing, Donna Bliss at the University of Minnesota, who said quite clearly she will never be on like Good Morning Today or any other, will never get media coverage because her research is about fecal incontinence. It probably had the most impact on hospitals and home care or long-term care facilities, huge impact on people's quality of life and survival, definite important area for nursing practice, but not for the Globe and Mail. There's not going to be a lot of research about how we prevent diarrhea in people who are hospitalized. So it's just that sort of being aware of who is your audience and who are the people and what kind of story it is that needs to happen. So thinking about when you should also be pitching your research is another piece for thinking about what that story is. So some key times when it might be worth thinking, should we be doing media? When it's first funded, if it's a big chunk of money. Otherwise, the university will be happy to, have it in Nursing Matters or one of the newsletters, the announcements locally. You can tweet about it. But if it's a big dollar amount and it's something that is a major sort of first for a particular area of research, that can sometimes be a time when you can pitch a media story, especially if it offers some really interesting collaborations internationally or some other sort of angle to it that that you'll frequently see those kinds of stories showing up even on like the Metro, if you read that on the bus or something. SFU lands $5 million for study of blah, blah, blah. UBC has new center open for X, Y, or Z. Those kinds of stories can sometimes happen with the research that you're doing. We have found, oddly enough, that we can actually get media coverage when we're launching a community report if it's being launched before a peer-reviewed paper comes out. And oftentimes we get more uptick because a community-friendly report is usually written with the general audience in mind, and so the key messages that come out of that and the key findings are usually framed and written about in ways that are not so technical and so professionally specific that it's a great starting place for being able to write the press release about the launch of the report. And you've got this report up on your website or available through Circle or something, and so you've got easy links to it as well. And it's something that can be read that's not behind a paywall like a peer-reviewed journal might be, or it's not in really professional language that might cause most journalists to go, multi-regression or multilinear regression, what? And what does interpretive phenomenology, like, where are you going with this? So it is that sort of thinking about community-friendly reports can actually be a really useful place for doing some kind of media related to your findings. If you're presenting at a major conference, usually a national or international conference, and this is the first time that key results from your research are being presented, sometimes that's the point at which you can also do a press release that will be going out and garner some media. That one's a little trickier, especially in nursing, because a lot of times it's not like we've just invented something new and it's going to revolutionize the whole field. We're actually focusing on clear areas of practice. So that's a little bit harder. It's also trickier if the conference is in a place where you're not. So, or like is not at UBC or near, in Vancouver. So I remember one year I was giving a 10-minute presentation of some of our research where we were looking at suicide attempts among lesbian, gay, and bisexual teens and sort of the trends, and noting that they were sort of holding steady for boys, but they were actually getting worse for girls. And because the Canadian Public Health Association conference was in Vancouver, local newspaper, the Vancouver Sun sent a reporter, and in our panel there was someone from Halifax and someone from from PE Island and someone from Alberta. Well, they weren't going to cover those stories. They were more interested in the local one, and so did an interview with me. And because it was a slow news day, it actually ended up on the front page, which meant it ended up in the news wires, which meant it ended up around the world and translated into a ridiculous number of languages. And it was sort of like, who knew, from a 10-minute presentation. But, it's a little bit harder if you're at a conference that is in Halifax and the research is about people in BC. So it's less common to get those kinds of major stories. They do happen sometimes, but it's harder to sometimes pitch those to public affairs to issue a concurrent press release. One of the most common ones, and a really useful one to be thinking about, is when your peer-reviewed paper gets published. Now that timing is now becoming a lot spookier than it used to be, this technical term, because it used to be that we would have an embargo period, and they would announce, it would come out in the print issue of the February journal issue, and you were embargoed up until January 27th, and then, so you would know weeks and weeks in advance, and you could craft a press release, and you could pitch it to media that you knew weren't going to break the embargo, and you could even send them the copy of the article, and they would have a story ready to go for the day the embargo lifted, and then there would be a bit of a media frenzy, and you would get a bunch of interviews. Now, they don't even tell you when it's finally in the print journal. You might find out that it's actually up online a couple weeks after it's happened. And increasingly, journals are actually putting the paper up online, early online, literally after it's been accepted and almost before it's been copy edited or formatted into their particular look and feel. They'll just put the original accepted manuscript up online for people to access with a document object identifier number or DOI number. And that can create some really interesting challenges. We actually had, we thought, well, until it actually gets formatted in their cool version and it's identified as a issue that it's coming out in with page numbers and everything, that we can't actually do a press release. So we waited on a paper that was about trends in sports involvement among LGBT youth. It was finally coming out as, here it is, it's going to be in the March issue. So February 1st, it was available up online. So we wanted to do the press release right after that. And we did the press release because they thought it would be really useful information. But one of the key ways that you can get widespread coverage of the research is the press release gets put up on a wire service called Eureka Alert. And Eureka Alert said, well, it originally went up in the dodgy looking Word document PDF in October, as soon as they had accepted it. So that's more than 90 days, so we won't cover it because it's already old news. So I'm now changing our strategy, and once it's accepted and it's online, that's when we're going to be starting to pitch whether or not a paper should, immediately thinking about, when it's been accepted, should we be thinking about media for it or not? Because having those new articles, the article just as it's now published, or at least visible and available, is a good timing for being able to actually get media uptake in different ways. So thinking about who your audience is as you're thinking about the media. If the general public is affected or needs to know, as I suggested before, then it's really likely you should do media and you should mention it to public affairs who your audience is. If it's managers or administrators of health systems or government bureaucrats of one sort or another, school administrators, chances are, if that's your audience, going through general media is not going to be as effective, primarily because the general public will struggle to figure out why this is relevant for them, and the busy people that you're trying to reach don't read the Metro or the Globe and Mail on a regular basis anyways, so they're not likely to get that news. If it's healthcare providers that are your audience, and the topic is such that it's also something that patients might be motivated to talk to their providers about or to be aware of, then it's a good chance that it might be worth pitching as a story. But if it's something that the general public won't have any impact on, and many healthcare providers won't have decisions about, I'm thinking about, for example, a great example of that kind of research would be staffing levels and acuity kinds of research. Chances are it would be particularly tough to figure out a way to pitch that for general media, but a really important something to get out to within the sort of the healthcare situation, unless there's a way that it's suddenly top of mind and you can frame it around how systems taking up this new management approach would be able to take it on. Anything that is where your primary audience is other researchers or other scholars, probably not. Now, if the pitch is, we've created a new tool for measurement, we've created a new research methodology, we've created an approach to some aspect of the research, or we're moving the field forward with these findings, you should take them up as researchers, chances are that's not going to be something that the Vancouver Sun is going to find of incredible importance that needs to get out. And chances are you're not going to necessarily reach the researchers either, because they're like, well, yeah, it's in the Metro, but did they even get the story right or the details right? So really it's kind of thinking about what those particular issues are. So an example of this is that we actually developed a new methodology to test trends and disparities, so that gap between the general population and a marginalized population over time in population surveys. This is a new statistical technique. I did not expect that would be part of my career, but we had a team that included Bruno Zimbo, stats god extraordinaire, and we created this new methodology. And we got published in the International Journal of Health Equity using an example of a set of trends to look at. But the big point about the paper was the fact that this was this new methodology. We didn't end up pitching that particular story because it was really one that needed to be going out in the peer-reviewed literature. Now, the following papers that were using that method, like the sports paper that looked at sports trends, that we put in the news, and we did mention, and nobody picked it up, that, hey, this is a new method. We're finally able, this is the first time that we're able to do this and actually look at these trends because we've developed a new technique. And yeah, all the newspaper coverage talked about the results, didn't care about the technique. So something to keep in mind in that respect. How do you identify the story in your research? This, I think, is in some ways the hardest part, because we do this research because we're passionate about it. And we think that this is really important, and we can come up with lots of scholarly reasons why it's really important to know this. Sadly, the stuff that we find really fascinating doesn't necessarily strike the rest of the population as equally fascinating. And so where we might be really geeking out on, this was so cool, we did it this way, and this is so new, the story for journalists might be so what? What's the key piece here? So some of the things you actually need to be thinking about in terms of ways that you might actually be able to get at the story within your research is to think about things like, were the findings unexpected? Was there something about what you learned that is counter to what everybody knows or popular knowledge? Is it counterintuitive? Because that might be the important hook or the important storyline to get your information research out. We found that worked amazingly well, repeatedly actually, when it came to LGBT youth and teen pregnancy. They have higher rates of teen pregnancy involvement than heterosexual teens. And you're kind of like, gay boys, teen pregnancy, what? Very counterintuitive. And that was what attracted the media coverage, because we could explain why, and we could explain what we knew. And that coverage got spread far and wide because it was just so counterintuitive. We even actually got satirized on a late night satirical news show called The Red Eye on Fox News at one point, which for us it was like, oh, this is bad news? No, score! We're actually reaching a demographic, the 20-something guys at 2 a.m. who are drinking beer and watching this, who will forget where they learned this information, but at some point down the road when someone says, well, lesbian, gay, and bisexual teens are more likely to have a pregnancy, they'll go, oh yeah, I heard that, without recognizing that they heard it and it was slammed. But, it just, so it is that interesting, that unexpected story, or what people might not know is one way to actually create a story for your research. Another is, does this highlight a lesser known group or break some kind of stereotype? So some of the work that John Olive has done around depression and men, for example, is a great example of that breaking of stereotypes, because the stereotype is women get depressed, not men. And so that's sort of one of the ways that the story ends up being accessible for a variety of people. Does your research alert us to a new problem that we should be concerned about or outraged about? Outrage is also good. If there's something in your research findings that are like, oh my God, we need to be worried about this, that is often a key message for a story or a way that you can frame your research that will get media uptick. And it's reverse. The good news that things aren't as bad as we thought they were, or they are bad, but we've got a new intervention that helps fix them. That's also a really useful story from the research that you're doing. We regularly get stories covered when I'm part of the BC Adolescent Health Survey and the Health Behavior of School-Aged Children Survey. And for the last 20 years, the results have pretty consistently been, guess what? Kids are not drinking and having sex and doing drugs nearly as often as we think they are. The majority of them aren't doing that. And in fact, the rates have been going down for the last 15 years or 20 years. And so we don't have the, oh, alert, kids are going to heck in a handbasket. It's the, guess what? Kids are making better decisions than they used to. We've gotten news coverage for it. I will say we haven't gotten as much news coverage when we say, look, kids are doing well, or they're doing better than we all give them credit for, as we do with, like, the last time with the health behavior of school-aged children. We were talking about, look, marijuana rates are at the lowest level they have been since we started measuring in the early 90s among teenagers nationwide. No, the story that everybody wanted to cover was the high rate of kids smoking e-cigarettes. So it is, this interesting, the media has this lens of danger, death, disaster, worry, like the sort of, that information is much more likely to be picked up than the, gosh, things are lovely, things are better than they used to be, or, things are, the happy news stuff. It's harder to cover, but it can be done, especially if it's an unexpected finding. And frankly, we don't always you wouldn't want to pitch your story as death and disaster if that isn't really the research you're doing. Media also really like firsts. So if yours is the first study that's ever done X, Y, or Z that you know of, the first that you've been able to find, that's like bragging rights that the media is definitely a go-to. We often can do it's the first in Canada, even if it isn't the first that's been done anywhere, and that also is a reasonable, or it's the first time with this population, or the first that we've looked at it in this particular way. So there are ways to try to pitch the first, and that is one that, again, media will consider that as a story, as a hook into a story. Now, it is important to keep in mind as you're planning your media story, if your goal is you're looking to change policies or laws, you really need to identify how severe the problem is, or that it's currently unmonitored. We had, for example, when Sabrina Wong and Joy Johnson and I did a study looking at homestay students in BC and their health issues compared to immigrant students who came with their families, and recognizing that, in fact, nobody was monitoring or looking out for them. Like, they fall through every one of the regulatory cracks in terms of Customs and Immigration lets them in and then doesn't track them after that. Child welfare doesn't have anything to do with them. Like, even when they would be responsible for inspecting foster care placements or certifying them, doesn't happen with homestay, even though they're minors. And so it's this interesting, they were falling through all the different regulatory cracks. So our story was pointing out their health issues and the fact that they were falling through the cracks. And it was actually one that we got some widespread coverage, and even ended up spurring visits to UBC from the Deputy Secretary General of the Japanese Consulate, and conversations with the Chinese embassy, and the Ministry of Education here in BC actually decided it was time to develop some guidelines and policies for international students coming to education in BC when they were minors. So it actually did have some uptake and impact, and probably wouldn't have if it got published in the Canadian Public Health Association journal. And may not have been seen by any of those people. If your goal is to increase the dollars allocated to a health issue or to change practices, it becomes really important that people see the urgency of the story, but also that you're pitching solutions, like there's hopefulness there. If you're looking to change hearts and minds about a perspective on a health issue, people need to be able to relate to and care about the group. So if you're really talking about people in very negative, stereotyped ways that dehumanize them or just reinforce a discourse around this group, you're not going to get that. So you need to be thinking about carefully, how are you representing the research, including, are there unexpected results, positive things that your research has shown that you can cover that create that hook of, they're not quite the way I thought they were. In my experience, the only time you get to really geek out about the technical elements of your research is when you've got a discovery, something new in terms of discovering some key finding in research. And since a lot of our research is applied nursing care and nursing practice, it doesn't fall under that, we've discovered the way cells work with each other in new ways, or we've discovered a new genetic link to blah, 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 or any of those things. And frankly, even then, you don't get too technical. You just have to figure out plain language ways to do that. It's also important to think about, you can use surprise, catching the attention of people, breaking a stereotype, instead of fear. So one of the ways, and this is an example that I just wanted to use, that gay-straight alliances in schools and suicidality, as I mentioned, one of the things we did with our research and what we emphasized in our press release was that not only did we see that gay-straight alliances and inclusive school policies reduce the odds of suicidal thoughts and suicide attempts among lesbian, gay, and bisexual teens in schools, as you would expect, because that's what they're for. But in fact, when it came to heterosexual boys, the odds of suicide attempts dropped by half. This was a startling finding. It was buried in our peer-reviewed paper. It's just one of the groups that we looked at. But it was, from a media perspective, surprising and unexpected. You mean it doesn't harm straight kids, but in fact it might be beneficial for straight boys too? And of course, the first thing they wanted to know is, well, why is that? And of course, the challenge is most of our research is really good at telling you what and how many and when and where even, but not so much the why. So we had to speculate about the why based on existing other research, but we came up with a plausible reason as to why these things might make a difference. And that was part of our press release, and that was part of the quotes, and that was part of our preparation for the interviews that happened. And we did get a lot of interviews and coverage. And ultimately, these findings ended up spreading to really unusual places, including the Smithsonian Magazine, of all places. I did not expect a little blurb about our research there. And Harper's Magazine, you know how they have that back page where it has like these little tiny, this number and what it means to in whatever, and the news of the weird, and they literally have like, I don't know, the number of kangaroos in something and the percentage of people who are engaging in oral sex, like all these really strange little, and it's literally just a phrase, and then they will link to the actual study at some point. They decided to put our research on the back page, in that section. As a result of that, I got a phone call while I was in an airport from a dad in Ontario who has a subscription to Harper's, saw that story and it said UBC and this, and he immediately Googled it and found the link and saw our press release and went, oh my God, my kids aren't gay, but one of them has been harassed for people thinking he's just not masculine enough, and he's been harassed, like people called him gay even though he's not. I totally see how this makes a difference for kids, because bullying does have, your research, this is great, you're saving lives. Is it okay if I share this with the Catholic school board that my kids go to school at? It's like, by all means. So this is the sort of thing where unexpected media coverage can also connect to and have ripple effects in terms of people becoming advocates for your research that you never even met before. Other examples of really effective research that we've seen here in the school, and there are way too many to list, so I just picked 3 out of thin air that were in the last couple years because of their sort of extensive research coverage. I already mentioned John's team and the study on men's depression, which breaks stereotypes, and they've had some really creative ways of engaging with media around events that are happening, talking about the research results in ways that become really accessible and then get picked up by the news media. Wendy Hall's research on sleep problems for infants and children, and even for youth and adults, has definitely had wide uptake. And in part that's because almost everybody has either struggled with a small child or a baby who's having trouble sleeping, or they've had their own problems with insomnia at some point in their life. So sleep is a universal something that everybody can immediately relate to, as long as the story that was pitched actually does talk about what are some of those ways that you can develop good sleep hygiene. And that is definitely one of the ways that Wendy's research has been taken up. And then another one was Colleen Varco's study of the costs of family violence, where they actually put a dollar amount on it, and it was a huge dollar amount. And that made the media, because it's oh my goodness, this costs way more than anybody expected it would. This is not just this is your own family, this is your own problem kind of circumstance. It's affecting our tax dollars and our health systems and our, it's got a big number there. And that alert, this is a severe problem, we need to do something about it, was what was the way in to get that media story framed in terms of drawing attention to the issue. And of course, the goal was to affect people's perspectives and to encourage resourcing around interventions. And so that particular approach of, do you know how much this is costing Canada, is a really successful media approach. Oops. So quick things in terms of as you're thinking about, you're going to talk to public affairs, and for you, School of Nursing, it's Lou Corpus-Bosshart, who is our public affairs link within the public affairs here at UBC. There are other folks who also sometimes will be handed if Lou is like too busy, other people might step in and help out. Really important thing when you're reaching out to Lou and saying, hey, I think I've got a story, we've got a paper coming out, or we are about to be presenting this as a major thing at a conference, or we've got a community-friendly report that's coming out and we're launching it at this event on this day. It's really important for you to think about what's the key, like what's the really, in one sentence of 20 words or less, preferably 10, what's the key pithy message of why this research is important? You're being able to explain in a paragraph what the story, what your research study is about in non-technical terms, thinking about those abstracts for our CIHR grants that are supposedly the lay abstracts. Yeah, not even that technical. Thinking about the really friendly, can you explain it to your grandmother? As long as your grandmother is not a nursing professor. That kind of thinking about it, and then pointing out to them if it's a first or what appeal it might have to which kind of audience in the public. You also need to be thinking about what are the recommendations or the why is this happening that isn't really part of your research. It might be in your discussions, the speculation. And this is where you need to step away from the scientist who says, we've got to hedge this 6 ways to Sunday, and we have to only go up to this point and no further in explaining the relevance or the importance or the implications of our research, because oftentimes we will, being good, cautious scientists, recognizing that one study contributes a little bit to the wider field, it's not the be-all, end-all, we're going to totally undersell the importance of the research that's been done. So you need to think about it in terms of, so what are the implications of this, and can we create those or those next steps, and not next steps for research, but next steps for practice or policy, even if we feel like, ooh, I don't think I'm quite ready for, like, I don't think we should say, yes, we need more of these because it's one study, GSAs, it hasn't been proven by 25 replication studies yet. But you have to be able to say, you know what, it seems to suggest we should be doing this, and frame it in that way. If you've got some numbers, that can also be really helpful, or some really drop dead but short quotes from some of your participants in the case of a qualitative study. They can be really great, but they have to be really simple, easy to understand, like percentages, not odds ratios or beta weights or anything like that. And a little bar chart that shows things going up or going down, or shows a really high bar for one group and a low bar for another, is, so people can see very simply what it is you're talking about. Those can be really great to also share with public affairs. Now, they're going to, first you may have to actually persuade them that it's a story worth going for, and we've had to do that a number of times, and you might not always be successful in that, but if they do decide, if it's a peer-reviewed article and you've just gotten it up early online, so you're within the 2-week window of it being hot off the presses news, it can go out on Eureka Alert as well, so it's worth thinking about getting it in soon rather than waiting. Oftentimes they will propose to create the press release, but it's a good idea for you to frame it a little bit, those key message, why is it important, what do you think should be done about it, in that email first, and give them the article, because they may totally zone in on different stats that you're like, no, that's not the really important piece here. Here's what's important, and they might miss. You will probably have to go back and forth in the press release because the first time around they'll put some quotes in where you're going, I would never say that. Either it sounds way too casual and friendly than what I would say, or just imprecise, or I've had a couple times when they've said things that it's like, no, that's not what the research says. That's in fact completely opposite what the research says. This is the actual finding. Or in one point, because we work with marginalized populations, they put in a statement that was really stereotypical, and it was like, I'm sorry, I would never say that in the communities I work with. That's just not the way I would say it because that's so disrespectful, and change it. So changing the quotes that you would be putting in, making sure that stuff is accurate. It is important, though, when you're working with them as they're writing these press releases, to make sure it's accurate, but you don't get hung up on total precision. Because we can get down into we are very well educated. We get down into splitting the hairs into well, it was only 97% of the population. So we can't say everybody or nearly everybody. We really should say the majority. And it's like, okay, it is important to think about, can you live with some imprecision if it's still mostly accurate? And it's not like you're going to completely lose. Remember, the audience is not going to be your fellow scientists. It's going to be the general public. You do make sure that you have those key messages around why this is important, what's new or surprising, what surprised you in doing the research, because every reporter is going to ask you that. So public affairs is going to ask you that too. And those recommendations. Having that information to put in the email, to contact them, or to have that conversation with them is going to be really important, because that will help frame how they will create that press release and work with you on it. Now, what if they say no? They're not going to pitch everything, because they've got press releases going out from all the different faculties and all kinds of different events happening. So they might not have time, or they might not have, there may be too many other things that are going out the same week. We can sometimes do our own press releases, and the people that you would get involved in helping with that would be Wendy McCarty in Applied Science, or Heather Swallow here in the School of Nursing. And even if we're not issuing our own sort of announcement or release, getting Heather involved is important, because Heather can put it up on the website for the School of Nursing in our news and alerts and events. It's also good to make sure that if it's a peer-reviewed paper, you're also informing Marilee, because Marilee puts it in the Nursing Matters, and all of that sort of works together. We also have a School of Nursing Twitter, and Heather is really great about regularly getting the School of Nursing tweeting going. And if you have Twitter accounts, you can actually tag team on that. So even if you're not going to issue a formal press release, you should really be thinking about social media. Is there a picture you can put up on Tumblr? Is there a link to the abstract or the open access journal article that you can announce about 12 times on Twitter at different days with slightly different wording? And if there's a news story that comes up and you've got previous articles that are out there, you can link back to them and point them out as influencing research that's currently happening. So an example of that was last week was the Transgender Day of Visibility. And we put out a brief link to our Trans Youth Health Survey. And on Friday, I believe it was, Victor Gilbert, the person who created the first Pride flag, died. And we have a paper that was published this year about how young people use the rainbow symbology and safe spaces stickers and things like that, and how they navigate them and use them for their own identity and pride. And this is a paper that was published in Symbolic Interactionism, so not exactly a high visibility journal, but we could tweet out, and our research shows that young people use this image, are still using rainbow imagery for pride and identity, with a link to the article. And we actually had a professor from Alberta replied back and said, just read your article on the plane the other day. Very interesting. So it's like, yay, another set of retweets to another whole audience. So thinking about social media, even if you're not doing the formal press release from the university, is another important way to do this. We have 7 minutes. Anybody have a particular research topic or research study that you'd be interested in some help with coming up with a story? Or do you just have regular questions about what's been covered here?